Hello everyone, welcome back to my channel. This is Priya from Vanakkam, Germany. Today I am back again with one interesting topic and most important topic for families with kids. Kids, those who are born and rising in abroad are facing speech delay due to multiple language. In Germany, it is really difficult to get a slot for speech therapists. Today, we have a guest who can share their experience and knowledge on various topics related to kids' speech delay and language development. If you are new to this channel, take a moment to subscribe this channel to get regular updates about Germany. And if you are ready, come let's get started. I'm really happy to introduce Ruchi Goyal, who is supporting and raising awareness on deafness and disability kids, also addressing and guiding parents whose kids have speech delay, and she is doing this service for more than 16 years. Not only this, she is an international speaker, mentor, advisor, also working in an international school in Germany.
You have already mentioned all those signs. But what I really felt is, so these signs are very commonly known in our kids. So is there any age specific after the particular age the kid is continuously doing this kind of steps, whether we need to go with the speech therapy or whether we need to go with the specialized person to check and what to know about this?
So the moment you, as far because we're talking about speech today, so let me address that. So what I would do is, if I'm worried about, I see the early signs. There is no speech, there is no response, or there's more signs, there's more sign language, pointing response only to a few things. Anger issues. They are not interested in. They're screaming and shouting, and they are aggressive. They throw a too much tantrum because or they hide somewhere. So then that is what I would worry about. I would speak with my doctor. Once they will give you a list of, okay, go to this, do these tests. You do those tests. The moment you realize, okay, my child has no hearing issues. If you have hearing issues, then of course you get the hearing aids, and then you have to follow up with that. But if there is something like a behavior because of lifestyle at home, which I will talk about in my other videos, then what I would do is they would advise you, okay, go to a speech therapist. And then you have to, like, they'll give you basically the Überweisung or that advice, and then you will go for speech therapy.
Okay. And at what age, whether it is a 3 or 4, or we can wait a little longer?
I started my speech therapy for my daughter as early as she was 8 months old.
8 months
And
old.
yes, and we've had a baby who was just born, and we found out in just about 2 or 3 months, because of some issues, they found out that the child was deaf. And we started speech therapy immediately. So you can actually start speech therapy as soon as there's a problem. So which is like,
Right.
even at 2 months, even 1 month, because they are like, if the parents are deaf, for example, so you surely have to check the baby who's born for deafness. So, and these days, there are so many tests at the child's birth. So you can make out something like deafness or Down syndrome. You will figure out at birth itself,
Yeah.
right? Because of the test and all that, you can find out. Now, once you know, then you immediately can take the required things that you need to do, and then immediately start with speech therapy. And which is required, what is required is the mother should be very engaged, because the child is with the mother all the time. And that's very important, that the mother and the child are together all the time, in the speech therapy sessions as well. And also at home, you are following those instructions.
Okay, so the thing which you mentioned is only for the deafness and Down syndrome, which we can identify little earlier itself. And what if the kid is absolutely normal, but the kid is not giving response, showing an eye contact? Is there any age that we can look into it, whether we can start at age of 1 or age of 2, or we can wait little longer? Normally in Germany, they are ready to wait little longer till 4 years. Only after 4 years, they are giving the Überweisung for the logopedy. So, what is your inputs on this?
So to me, the first 5 years are very crucial because that's the time when the brain of the child is most plastic. So it's like a sponge. It'll take everything that is around. Now imagine for 4 years, you know that the child has a problem. Okay, that is a time when he's picking up language, he's learning to maneuver sounds and walk around, understand what's happening around, use hands and feet, discover new things. And imagine, he doesn't have any source of sound. So even when we are doing any for example, he's playing with Lego blocks. Okay, now there is no language input, he's just playing. Now if you tell, there is one situation, okay, he's just playing, so he has no understanding of what he can do, he's just playing the way he is. But imagine now Priya sits down with a child and you are telling him, okay, now can you put the red block on top of the yellow block, and oh, there is a blue window there, can you pick up that? So imagine the child is hearing, is actually listening to all those instructions and forming it. Now that understanding is so important of for the child to be able to maneuver next time. Next time he needs something like a blue thing, he will know that this color is blue, this color is red, this is not blue, and this is not red. So all this is so important. Now imagine the child who, for him, he can see it is blue and red and yellow, but he can't differentiate. If you ask him, what is this color, he will not know. So that input is very necessary. So I feel very sad when when I get these parents who are saying that, oh, they're not letting us get through the speech therapy, they're not giving us Überweisung. I would not wait. The moment I know the doctor says that this is the problem, I would start speech therapy immediately. Are you waiting when your normal baby is born? Are you waiting, okay, till 4 years of age, I will wait and then I will start teaching apple and banana and everything? No, we are talking, oh baby, what happened? Oh, look at, he doesn't understand anything. He's like just newly born. Oh, look at your nose, is so cute. It's just like mama's nose. And I think your eyes are like your grandmother. Oh, who's come? Grandmother has got you a nice, beautiful dress. Does the child understand anything? No. He's just born. He's just 2 months old. He's just 3 months old. Doesn't understand. He's in, oh, we are looking at him like that, making those sounds. He's also guggling away. No one is understand. The child doesn't understand anything. But in all that confusion, the child will figure out there's some kind of communication happening. So the more communication you have in those first few months itself, that will carry on. So
Okay.
with both my children, I did that. Like my son, I was very talkative otherwise also. And I love children. So when my son was born, constantly we were talking. So he turned out to be very excited about life. He would play, he would do this, and he would do that, and he was always, very constructive in doing things. With Prisha, because of her deafness, I got engaged, so she was always engaged with a lot of other things. So she's become very creative, and her mind is also full of ideas, and she's constantly doing things. Why? Because it was all about engagement. So I would not ever wait for speech therapy lessons. I would actually start to say, okay, I have a problem, do it right now.
Okay. Good. Good, Ruchi. I hope the viewers got some very elaborate information how one can start speech therapy, where they have to look, early signs, what are the steps they have to take, all those steps. Well, we're going to discuss the how one can raise a multilingual kid in Germany or in abroad. So, viewers, please stay tuned and watch this video, share this video to your friends. Until bye bye from Vanakkam Germany, Priya and with Ruchi Goyal.
Thank you. Bye.
Okay, bye.